Wearing a mask improperly can actually increase your risk of getting disease. It can also give you a false sense of security, and you see many of these pictures with people out and about closer than 6 feet to each other, but still wearing a mask. If you're sick, wear a mask. If you have a mask and it makes you feel better, then by all means, wear it, but know that the more you touch your face, the more you put yourself at risk. And know that right now the data isn't quite there to say that there's a net benefit of individuals to the individual of wearing a mask.
Did you catch what the Surgeon General just said? People who wear masks who then step into that 6-foot zone closer to each other are not actually helping themselves. That's him pushing back against the need for all Americans to wear protective masks, saying they could give that false sense of security if not worn properly. This amid some reports that the CDC is considering recommending the general public wear face coverings in public. President Trump at the White House briefing yesterday said it's something that they're looking into. Watch the president.
We're getting certainly the number of masks that you need. We are in the process of talking about things. I saw his suggestion on that, so we'll take a look at it. For a period of time, not forever. I mean, you know, we want our country back. We're not going to be wearing masks forever, but it could be for a short period of time.
However, the top virus experts at the World Health Organization yesterday reaffirmed their advice that the general public not wear masks, and they also share some of the Surgeon General's concerns.
We don't generally recommend the wearing of masks in public by otherwise well individuals because it has not been up to now associated with any particular benefit. It does have benefits psychologically, socially, and there are social norms around that, and we don't criticize the wearing of masks and have not done so. But there is no specific evidence to suggest that the wearing of masks by the mass population has any particular benefit. In fact, there's some evidence to suggest the opposite in the misuse or wearing a mask properly.
So that's making news in one lane. Listen to this from the USA Today report. An MIT researcher says droplets carrying coronavirus can travel up to 27 feet, raising new questions about whether the current CDC guideline of staying 6 feet apart is safe enough. Medical panel slides back in. Dr. Nicole Saphier, Dr. Keith Armitage, and Dr. Marty Makary. Dr. Saphier, I'm going to start with you. You know, one thing that an expert told me is that it isn't just 6 feet in front of you, but if you could do it, it would be a spherical all around. Just give yourself 6 feet in every direction. I don't know. What is the answer? Dr. Saphier, can you hear me? All right. Dr. Makary, will you pick up?
Sure. I remember in the medical school textbooks, still photos of droplets when somebody coughs or sneezes. And based on that research, we know that the droplets travel approximately 3 to 6 feet. That's where we get that number from. On the WHO, they've got to think about India when they talk about wearing masks. They don't want to create a hysteria and hoarding around the world where they may not have masks everywhere for everybody. In the U.S., though, I can see the benefit. Even though from the virology standpoint, it's not a perfect barrier, it does remove the stigma so that those who need to be wearing masks do wear them in public.
Oh, that's interesting. Yeah, you know, Dr. Armitage, the Surgeon General brought up an interesting point, I thought, and helpful as well. Because they slip and slide and all of that kind of stuff, and they're kind of, and I find just from wearing one just to see what it feels like, it makes me hot. I mean, I don't wear them inside my house, obviously, but I wanted to know that feeling. And so there's a reason to adjust, and then you're just touching your face all the time.
Yeah, that's a really interesting point. You know, my thought process about masks is evolving. I think it's clear that in high-risk situations, you have to use the N95. Everyone knows that. And the public should not think a mask, should not have a mask give them a false sense of security. I think a lot of doctors I've talked to think wearing a mask makes it less likely to touch their mouth or their face, especially their mouth. I think wearing a mask in public may help people infected from spreading the droplets or the fomites. You know, fomites are the viral particles on hard surfaces, and so if people are in the asymptomatic phase or people coughing in public, there may be less spread of fomites, and there may be some protection from wearing a mask if you are exposed to droplets. Clearly not 100%, and maybe 70 to 80%. There's an interesting experiment going on. The Czech Republic, a country of about 11 million people, has decided that they're going to mask everyone all the time in public. There's been this big grassroots efforts to make masks, make cloth masks.
Okay. Does that work?
Well, not to deplete the hospital supply. Well, we'll see. We'll see if, when the data comes out, if this experiment of a country of 11 million people makes a difference. I think a lot of people's thoughts are evolving on this issue.
Okay. I want to get to a viewer question if we can. Thank you, doctors. And I think we have Nicole Sapphire back. I'll give this question to you, Dr. Sapphire. Ron R. is asking, I'm a paramedic and my department has advised us to put our N95 mask in a paper bag and reuse it after each shift because of shortages. Is this safe and will the mask still be effective? Dr. Sapphire?
Now we're all given a single mask to be reused throughout the entire day. Do I lose you again?
Nope, you're back.
No voice? Okay, so sorry about that. No, so we're all being asked to do that right now. We're all given a single-use mask, and we're supposed to be reusing it every day. At least that's what we're doing. And same thing, we're putting it in a labeled paper bag. And, you know, it is shown that you can actually reuse it over and over. But the truth is you want to make sure that the inside of your mask stays clean because the outside of it is contaminated. We have there's this company that's now shipping out machines all across the nation to actually sanitize these masks, which would be an amazing thing. They said they can do it up to 20 times to reuse the mask. So even if it is a somewhat contaminated N95, that's going to be better for you than absolutely nothing. So I highly recommend still doing that, but doing everything you can to make sure that what's ever on the outside of the mask doesn't get to the inside of the mask.
I've heard of some people spraying the outside of the mask with a disinfectant, letting it sit for several hours till it dries. I don't know if that helps. Just a quick yes or no, Dr. McCary.
You got to be careful because you don't want to inhale those chemicals because that can be an irritant to your as well, which actually can predispose you to the infection. So you don't want to be irritating your lungs.
All right, Dr. McCary, I'll give this question to you. It's from Melissa P. Let's watch.
Why is it we don't